All right, we are drawing down to the close of our health promotion one. Or two classes we have leave or one. When I can sit back, relax, and just listen to you guys talking to me. I'm looking forward to it. Can I tell you? All right, we are going to be looking at renewal of health promotion this afternoon. And these are the objectives that I do hope we'll be able to achieve at the end of this discussion, that you should be able to outline what is renewal of health promotion and justify its, that should not be it, that should have been its importance in improving population health. You also should be able to describe the 4 strategic plans that should be used in the renewal of health promotion, as well as plan ways in which the renewed health promotion strategies may be utilized to enhance health in specific settings. So when we talk about the renewal of health promotion, the first thing that we want to have an understanding of is what is renewal. And renewal is the act or process of making changes to something in order to improve it so that it becomes more successful. So whatever we have as something working, we want to improve it. So you talk about remove renewal in some like in the business sector, they say that they are re-engineering and they are re-whole part of things, and sometimes in that process you find that they lay people off because they are restructuring and they are re-engineering. But in health promotion, we want to look at ways in which we can refine what we already have in working with the people so that it can be better utilized and better serve the purposes for which it is designed. There are different approaches such as the political, the social, and the technological that are really needed as we try to improve health and to level the playing field by reducing inequities. I would have spoken several times about the whole business of inequity. The fact that despite all of the efforts that we have put into it, we have not yet reached that place where the playing field is level for the persons that we seek to serve. The question can be asked then, is health promotion aging? Why is there a need for a renewal? Now, it has been known for over a century that health is influenced by social and political factors, and hence the health system by itself would not be able to improve health. So there are changes that needs to be made, but those have to go through Parliament. It has to be channeled through the political system for it to become laws or to be signed off on as policy. And so we cannot do it without the political persons on board. The term health promotion would have been around from 1945. That is many, many years ago, like about 83, 82 years ago. It has been around for a long, long time and was coined by this man. His name is Henry Sigerist, and he was a medical historian. And this is coming from the gentleman by the name of Kumar, 2012, who actually helped us understanding that health promotion is not something that is new, but it has been around for quite a long time. It is also, when we look at a landscape for health promotion and whether or not it is really changing, we have to recognize the fact that it's a dynamic movement for health promotion, and this dynamic movement is taking place across the region of the Americas. And it is not just across the region of the Americas, it's a global thing that is happening. This whole trust into trying to be healthy is a part of what health promotion is all about. It is really a global phenomenon. Ministries of health in over 30 countries and territories across this region, and here we're talking about the Caribbean region, have convened meetings, and they have had meetings with intersectoral actors, they have had community members in engagement, and they have also engaged civil society. And they are doing this because they really want to situate health within the context of the sustainable development goals. And it's the development of those development agendas that they would have had. And for Jamaica, that development agenda is the 2030 agenda. And in a previous presentation, we would have looked at a different titles given to these development agenda for different countries across the Caribbean. So, do we need to make a change at this time? There has been several international conferences since then. And we talk about the Alma Ata Declaration, we talk about the Ottawa Charter, the Jakarta Declaration. I would have delved a lot in these when we had looked at different charters when we were going through the Ottawa Charter and what transpired since its inception. And given all the changes in epidemiology, demography, and globalization, the time is ripe for this renewal of health promotion, because we can't say stagnant, but we have to look at a changing environment, and whatever strategies we are going to bring to the table must be in keeping with the changing global environment that we are actually in. And so there was a call for health, and there was a search for a better, what is this thing? The font has changed. The search was on for a better health and well-being, as well as increased health equity. And the Ottawa Charter for Health Promotion, which was developed in 1986, as you can recall, outlines the main strategies and pillars of the health promotion. However, there was a need, and there still is a need, for a reinvigoration and a renewal of health promotion as we go forward. And that reflects, and whatever we are going to be doing must reflect contemporary realities of the region in any efforts to achieve better health equity and to contribute to the achievement of the sustainable development goals. So it means that we can't have this one paintbrush that we used to paint everything, but we continuously have to be refining and redefining what we do. So for example, when we had like the COVID outbreak, I would have had several different presentations, but it was all about COVID-19. Why? Because there are different target populations that you have to engage. So the way I would do a presentation to engage students in a primary school, I could not use that same presentation for a group of healthcare workers. I could not use that same presentation for an adult community audience. So we have to, I usually have to remake the presentation to fit the specific audience that I am going into. So we'd have had a whole lot about health promotion, but then we need to do some renewal that we can keep pace with changing environment around us. So what then really is the renewal of health promotion? And this is the process of reaffirming the fundamental principles that were articulated in the Ottawa Charter while reinterpreting them for contemporary issues. And we look at issues such as globalization and digitalization. And you will admit that globalization has brought the world into what is called a global village. So gone are the days when it was them over foreign and we over here. Because of the ease of travel and access, it takes just one, not even a full day, for disease to move from one region to another. If we go back and we look at the, it wasn't SARS, it was the one that came after SARS. That started in a, when there was a conference in China. And by the time the conference was over, that germ was globe-trotting. So persons who returned to their country from that particular conference, once they enter the hospital for, it was a respiratory syndrome. It was a respiratory infection. I can't remember the exact name. But once they returned home and they reached the hospital, they were under total shutdown. So you find that the rate at which it was spreading, those who were in the hospital, once they enter, They couldn't go home to their family. Nobody was allowed in. It was a chaotic time. So we have had those issues, just that particular one did not do the global tracking the way COVID-19 did that global tracking. So we have, because of globalization and the ease at which people can travel, that germ can move from one country to another within a few hours and can trigger a whole tsunami in other countries. Digitalization, we see where that increasingly there is being stress on us going digitalized, in a digitalized economy. And so the government is pushing it, and they are pushing it from all different angles. But I say there is nothing wrong in digitizing certain things, but the extent to which they want to take it. It was just this morning where I was reading an article on the internet where I think it is Sweden, that they are now injecting a little chip into the hand, and that chip have everything. They don't even have to carry phones. So I don't know only technology work. Maybe it has a what do you call that attachment to it? It's not Wi-Fi.
It's probably a RFID thing, similar to what it is they use to tap your credit card or debit card.
I'm not hearing you clearly, Daniel.
Oh, sorry. I'm saying that it's probably an RFID thing where it is that you can tap your credit card or debit card, a similar chip.
Exactly. That's the kind that they're saying, no, it's for convenience. But I say to persons that it's slavery of a different kind.
It's
because when they have total control over all of those things, all they need to do is to press one button and everything shut down, and you're not able to access anything at all. So I hear people cursing out that those who have concern that they are backward and they don't want to move forward. And I'm saying move forward into what? We are slowly losing autonomy over things that we had control over. One person, press one button, and everything shut down. And we don't realize what we are gravitating towards. All we can think about is the convenience. I don't have to walk with cash. I don't have to walk with any handbag. I don't have to walk with this. I just sweep mine across a little pad, and everything that I want is supposed to be there, and it can happen. And so while we do embrace development, we need to stop and think carefully about what is it that we are embracing. But I promise you that based on this push for digitalization, that we are moving from the slavery that we would have abolished into a different form of slavery. Because this time, all the government what I need to do is to say to us, jump. And we need to just ask jump how high. Because if we start to protest, and go there and block the road and all, they just press one button and nobody have any access to anything. So we are going to be controlled even worse than how we were in slavery. But it is all a part and parcel of development and moving with the current technology. So maybe I am old school and you don't agree with me, but that's where that's the lens that I am looking at what is happening from. So I'm not saying no to the development and the digitization of something, but for me, there is something that should not go on that platform. So that's my point of view on it. We also have to look at social and economic inequalities and the fact that we have been having increase in the non-communicable diseases. We know the whole issue of climate change, and we can look at what happened with Hurricane Melissa, and they're actually cussing out the government, that the government has something to do with the hurricane and the force of the hurricane. So a whole lot of things, yeah, it's true. A lot of things are going on out there. And we do know that they do have technology, and technology is well advanced beyond our capacity and understanding, because we are not, we don't have access to the extent to which technology has advanced. So the question now is, what is truth in what is going on out there? What you do picnic with the donut in the class, Jesus. So I am laughing because your colleagues inside the classroom are having a whale of a time with junk food. And we're talking about health promotion and healthy eating, right? So talking about emerging pandemics And we could have seen this, we have seen what happened with COVID-19 and the pushback to the vaccine because persons were not embracing the technology and the quick ease with which they were able to come up with a vaccine. I mean, things drop today and tomorrow vaccine is available. Questions were being asked, a lot of questions. They call it conspiracy theory, but if you're a Jamaican, there's an old saying, if you don't go so, in there go so. Yes, I will hear our grandparents with those things. And also impacting us was the rapid demographic and cultural shifts. I would have seen where we have moved from the demographic transition, where we move from a young population and we are going into aging population. And with young people like yourself, declaring war on birth rate, then you know that we are really going to continue to age and age for a while. And one wonders what is going to be happening to the population then. But then at my age, I may not be around to see what transpired at that particular point in time. So I just ask you that you keep your eyes open for what is going to be happening as you move forward and go ahead. Also, one of the things that we have to look at when we think about the whole business of the renewal of health promotion is that it was officially endorsed in several World Health Organization and PAO conferences. I would have looked at some of those last week or earlier this week. You have the Bangkok Charter, which was 2005. I spoke about the reorientation of health promotion towards globalization, equity, and partnership. The Nairobi one was a call for action, and they were asking for a stronger political commitment and evaluation frameworks. In Helsinki in 2013, they look at the whole business of health in all policies. And in Shanghai, China, they had a declaration in 2016 that linked health promotion to the Sustainable Development Goals. And in 2023, there was a reflection, a Caribbean reflection, spearheaded by the Pan American Health Organization. And in this particular meeting, they were reaffirming the Caribbean Charter that would have been developed before. And so there was also a call for renewal and the repositioning of health promotion as part of the regional agenda. And so there is indeed a need for revamping or improvement of our health promotion through the use of the social, the political, as well as the technical initiatives to address the social determinants of health. And so we're really aiming in this whole renewal business to improve health and to reduce health inequities. How do we do that? We need to reinvigorate, we need to redefine, and we need to adopt health promotion principles and practices as we respond to the new health challenges and as different conditions come on the agenda. It is going to require different challenges to handle them. And going back to COVID-19, that's the most recent one we'd have had, and it really took a lot and for us to really manage that particular one. And initially we were not managing. And it took a while for us to manage. I hope that there are lessons that would have been learned. And because going forward, there are going to be others. There are going to be others. This whole business of free emerging diseases is really going to be happening. Some of them, like COVID-19, you have no idea where they came from. I mean, on the ground, people are saying have a lot of theories as to its origin, and we are not getting anything confirmatory to refute or substantiate some of the arguments that have been put forward, and sometimes the wrong target get blamed for what we are seeing. So when we go out to eat, we are actually hitting at the wrong place because that's not where the origin might necessarily be.
Everything making a lot.
We also have to look at social. Go ahead, Daniel.
I said everything making a lab nowadays. COVID, Melissa,
Because
everything.
Persons are convinced that COVID-19 was a lab thing that went bad. And there are some realities that we probably need to face. You see, this thing that is called biological warfare is not a myth. It is not a myth. And we have these countries that are constantly at loggerheads with each other. We have absolutely no idea what is going on in their labs. And so even when things come out, I am sure they are not going to say, yes, this is true. Everything is going to be labeled as conspiracy theory, just like how when the COVID-19 vaccine came out and persons had questions, rather than to respond to the questions and put people's mind at rest, they labeled the persons who have questions as anti-vaxxers. So it's how we respond to the queries that comes forward. So as you're rightly saying, Daniel, the lab is a very busy place and there is no telling what is coming out of it. Yes, Cindy. Cindy, your mic is open. So there are some social realities that we have to look at and we need to respond to those. And the policy environment, particularly in the 21st century, what is it they are going to be coming forward with? How are we going to respond to these? Or will the population actually respond to some of these policies that are being put forward? So when we look at the whole business of why renewal, why is it necessary for us to look at the whole business of the renewal of health promotion? There are several forces that we have to take into consideration. So there are challenges and there are implications for these challenges as it relates to health promotion. We can look at persistent inequities despite decades of health promotion. So though health promotion has been around for so many years, a lot of work has been invested in it, we do still have some problems because there's a need for a stronger focus on social justice and health equity. And even though you have the health promotion practitioners, we are not operating in silo. You may not be in a position to sit at the table that determine the policy and the content of the policy. So there is always that constant challenge that is there. Globalization, trade and marketing of unhealthy products. Yes, stress on the unhealthy products. Call for multi-sectoral action and health-oriented public policy. I would have seen where some efforts are being made here in Jamaica, spearheaded in particular by the Heart Foundation of Jamaica. Now, Cindy, can you share with us anything that is happening in St. Vincent and the Grenadines? She's online, I saw her.
Miss, can you repeat for me, please? I was just going in my car, so I didn't hear what you said properly.
Okay, so we're looking at the whole business of the need of for there to be a call for a multi-sectoral action for healthy-oriented public policy. And I would have made mention of in Jamaica here, where the Heart Foundation is really behind that particular campaign, where they want to see things change so that the nation can have choices and they are aware of the choices that they are making. So for example, they reduce sugar in drinks, especially those that are being sold to children, and some of the big products that we have in the supermarket where they are pushing for the front of packaging labeling. And so I was asking what is happening in St. Vincent and the Grenadines regarding that.
Oh, so in terms of health and with the children, what we had started doing is changing up the school feeding program in the primary schools mainly, where they are part of a program where they're only allowed to use natural seasonings because of everything that is allergies and the unhealthy stuff. So this school feeding program are only allowed to use natural seasonings, which is a base off and on, because natural seasoning for Caribbean people who have flavorful palates, and in our homes we don't really use natural seasonings alone. We use the pre-pack seasoning, the Maggi cubes, and they're introducing more fruit days, reducing the juice that will give. We push for more local juices now and fruits at least 2 days per week in some schools. So while that is a good initiative in terms of steering the health of our children, starting there, it's a pushback because now the children are not accustomed to those. They say the food is bland, and that's not what they're accustomed using at home. So they have a lot of children still want to eat outside of that provided program.
And so you recognize that is indeed, so thanks for sharing. There is indeed a challenge because the effort is being made by the policymakers to put things in place for the benefit of the children, but the very parents are pushing back at these efforts, and the children have no control over the way their meals are being prepared or what is being served to them. So we do have some of those challenges, and we did have some similar challenge here in Jamaica where parents actually push back at the reduced sugar in the beverages that were being sold to their children in the supermarkets as well as in the schools. There's another challenge of the rapid digital transformation, and that can present new opportunities, or it can also produce risk. Because you have access to the information highway, and everybody now is into their TikToking and their Instagramming and their Facebooking and all of those things. You have no control over what is going out there into the atmosphere, what people have access to. So while the digital space provides a good platform for sharing information, we have to recognize that it's not just health and health related personnel that are on those platforms. It's an open platform for everybody, and you have no control over what is being posted. So though it represents an opportunity to reach your target audience, it can also pose a risk because it can upend your campaign based on what information is out there, what people are accessing. We are the whole business of climate and environmental crisis, and health promotion must engage in sustainability and resilience. Declining visibility of health promotion within the health systems. Again, we have to reassert health promotion as a strategic function, not a peripheral activity. Meaning that at the planning table, it must be a part of that process and not just be seen as an afterthought. And the COVID-19 pandemic helped to reinforce the importance of community empowerment, digital literacy, and the social solidarity that we need to engage on the table as we go forward. And so you have the renewed vision of health promotion includes the following, and we're talking about some key elements now for this renewal agenda. The repositioning of health promotion within national development. So you need to integrate health promotion into all policies. So you look at things like, for example, in education policy, and we do have some of that happening here in Jamaica. There's a healthy health and lifestyle part of the curriculum, health and family life. Health is was an integral part of the development of the current one that they do have. So they are part of the education mix. The challenge that we sometimes have though is that we do have these documents drawn up, but it's the implementation that creates that problem. And if the teachers do not feel comfortable to deliver, then it is not going to be delivered. So though it is there, it will be just placed in file 13 and sit there and gather dust. What we are trying to do when that particular health and family life education curriculum was being, when it was rolling out, we had several trainings. We had asked the school to identify a teacher or teachers that would have had responsibility for rolling it out in the schools. In some schools, they would have used their school nurses to do that. But you make a plan for a workshop or a seminar to go through it and let them understand, because we want their comfort level to be where they are able to deliver some of the topics that are there. But you find that even after you have that training, when it is time to deliver some of the subject areas, they will still call on you to come in and do that delivery. It has to do with their comfort level. So when it comes to things like sex and all of those things, not every teacher is comfortable talking to the children about it. So they will call on the healthcare worker to come in and deliver. And the truth be told is that these youngsters, because of the access to information, sometimes can wheel their fingers around the teachers in terms of some of the information that they have access to. We also have to keep in mind that as small as they are, some of them are practitioners. And so when they come into the classroom with all of those experiences and information that they have access to, they may sometimes pose some questions that the teachers are not comfortable handling. And sometimes they don't know, you know. And many years ago, even before that curriculum was as it is, I was teaching a class, it was a grade 3 class at a primary school. And we were talking about, we were doing the whole business of puberty. And a little one just raised her hand. And I said, yes. She said, then teacher, you grow here yet? No. Just out of the table. That was the last question I expected her to ask me. But she just simply asked me if my grow ears. I said, yes, baby, and move right along. So you have to be at that place where when they drop those questions on you unannounced, you just handle them with and move right along. Yeah, her name was Kamika. That was what she asked me. So I just said, yes, baby, I will move right along. So, I mean, if I had faltered, then you can imagine what would have happened in that classroom. So we have to, and sometimes the teachers are really not prepared for that. And these youngsters now are even more knowledgeable about these things than those little ones so many years ago. So I was kind of frightened when she asked me, I just said, yes, baby, I move along. Give her the straight truth and just move along the corridor. When class was finished, I laughed. I was like, my God, the girl just asked me that question. So sometimes we do have some of those challenges. So we try to help the teachers to be at that place. And sometimes they themselves are not comfortable with their sexuality. And because of that lack of comfort, they sometimes can't do what needs to be done. We have to link with this sustainable development goals because we talked about long-term sustainability of these programs. We also need to strengthen health promotion systems and capacity. So we have to build trained cadres of health promotion professionals. And this year I have what, 6 persons in the specialist group?
Yes.
Last year I had only 1.
Really?
Yeah. And the year before I had 3. And I was like, no, God, this can't work. I said, this cannot work. And I asked him for 10 and he gave me 6. And I said, thank you. Next year we are going to up the ante. So we really have to go along, but we have to build capacity. Out there on the field in terms of those who are practicing, we have moved a long way in terms of the number of persons working as health promotion officers. When I was working in St. Catherine, for many years, I was the only health promotion officer in St. Catherine working. The only health promotion officer. Now I can safely say that there are 4 officers in the parish working. So we have come a long way. But it was not an easy feat to get there. We have to justify why we need to have more health promotion officers on the field. So when we put in the requisition, we have to go to the Ministry of Finance and argue about it for it to even get on the establishment at all. So even when we talk about strengthening the capacity of the system, it is a process. And we have to stick with it. So we have to be fighting with government to give us what we need to do the work that they have given us to do. That's what it boils down to. So we have some of those. We have to institutionalize health promotion units within budget lines, and that we actually had to do. So at the beginning, so I think about October each year, when you have what they call a budget call, health promotion officers also have to do their budget. So they have to do their program plan, what is that they plan to do for the next fiscal year, how they plan to do it, and what is going to be the required finances or resources to carry through and submit those. I mean, we submit year after year, but it doesn't mean that we are going to get any money. Yes.
More than he needed.
Mm-hmm.
He asked more than he needs so that the job short then.
Sometimes it drops nothing at all. Not being honest with you, sometimes it drops absolutely nothing. But we are now making sure that it is a part of the budget line. So let it not be said that we did not make a request in terms of what was needed. If we don't get it, doesn't mean that we don't do it. So sometimes the officers would get frustrated and that every year they ask them for this budget, that when activities are to be carried out, they can't get any money. But we said still put your budget in nevertheless. Because if you don't put the budget, you have no grounds on which to argue your points and still do your budget. So we have to make it a part of the budget line. The empowerment and equity as a central pillar or as central pillars. So we have to focus on our vulnerable, marginalized, and underserved groups, because those are hard to reach. There is an underserved group that is hard to reach, and it's those who are in the prison system. A captive audience, but it's to get to them. The amount of red tape that you have to, because they're incarcerated. And you're talking about the business of security.
Oh.
And we had a program once at the women's prison, and the amount of red tape that we had to pull that year just to get to go in. And when we are going in there were like probably 3 or 4 checkpoints. I am serious. You seem to have more checkpoints at the female prison than what you have in the male prison. And we had to go through all of those checkpoints. And then part of the tokens that we had carried in, we in our ignorance were carrying some little caps. They said, because they went through everything that we're taking in, and those we could not give to the inmates. But then I understand why. Because they can't cover their face and do things that they ought not to be done. So you have to think about everything that is involved. So you talk about that collaboration, that partnership and the discussion. You can't just sit in your office alone and make those decisions. You have to have that discussion with the organization before you can actually move in. So it was very difficult to get into that organization, but we were allowed in and we did quite a lot with them. We look at the numbers, helping them to know their numbers. So we did checks for diabetes, hypertension, as well as cervical cancer, because they were not able to have easy access to that kind of care. And so we have to do that for them. So sometimes we have to take the paid service to them because they cannot come out to access the service. And so
different presentation for them. For them. Basically, like each mean presentation, if they modify this thing on your audience, what would you have to do differently?
They're adult audience. So you, in terms of looking at a disease condition, there's not much in terms. You just tell them what it is, and the etiology, the transmission, signs and symptoms, what they need to do to prevent in terms of healthy lifestyle practices. But you also have to remember that because of where they are, they don't have control too much over things like their dietary intake. It is what is served that they are going to have to take. So you'd have to have that engagement, with the authorities in terms of what is it that they need to prepare and serve them to ensure that they have a healthy and balanced diet. So it's a long process, and you have to go through a lot of different things to get there, but we still try. We also want to promote participatory governments in the health decision. So health cannot sit by itself and make that decision. When we are going to women prison, we also carry in Ministry of Labor and Social Security as a part of the team that went in. And so they were able now to discuss with them social net benefits that they can access and have access to. So it has to be a collaborative effort when we are going into some of these institutions and to help institutions to understand their role. Talk about the whole business of digital health promotion, leverage technology, social media and e-health for behavior change and community engagement. We have the platform that we can actually utilize. And I do know that the Ministry of Health has a presence on most of these social media platforms. And so they have access to the information from that end. And we have to also guard against the misinformation and digital exclusion. What we mean by digital exclusion, we can't focus all what we are doing on the digital platform, because you're still going to have that segment that do not have access to the digital platform. You yourselves know that in some of the health facilities that you work in, there's no internet service. So we have to make an effort to meet. So it's a multi-strategy approach that we have to actually take. When we look at cultural relevance and the contextual adaptation, we have to recognize that effective promotion must resonate with local values, language, and norms. We have to take into consideration the cultural nuances at different levels. So even here in Jamaica, you have today's culture within the culture. What may obtain for an inner city community may be is different for our uptown community. You'll find that in lower level communities, they are more receptive sometimes. They are more willing to listen to you. You see the ones uptown, they peep through the window and they drop back the curtain. And you'll still say you're not until thy kingdom come. Or release the Doberman. So different audience, different things will happen. Within the Caribbean,
What I did not watch the next one. And what did you buy?
Nicole, your mic is open. We hear everything she discussed with the patient. All right. Within the Caribbean, this can include using things like music, storytelling, and community-based leadership, and we have touched a little bit on that yesterday. Evaluation and accountability, this is where we often fall short. We have done a lot of work, but in terms of evaluating the impact of what we would have done, that this is always not happening in a proper way. And part of that is because when sometimes the programs are being developed, they did not build into that evaluation component. And so sometimes we don't get that part done. So we have to move from activity-based measures, like a number of workshops, to impact-based evaluation. What are we seeing in terms of changes with regards to behavior and policy? That is where we actually need to get, when we are looking at the accountability and the evaluation component of that. And we are going to be touching some more on some of those when we do health promotion too. So what is it that we know at this time? We know that much of health is influenced by social factors. We also know that the region of the Americas has high levels of inequities. We also know that inequality can damage people's social cohesion. And one of the things that we have to be guarding against now is with the aftermath of Melissa and what is happening on the ground. If we're not careful, we are going to have the inequality in the social cohesion and the distribution and all of those things. And there's rumbling already taking place. So we are hoping that the government will already put a lid on it, because everybody has been affected in those areas. Whatever is happening needs to be done in a way that it is humanly, socially acceptable. It can't be that politics be a part of the distribution, because if that starts, you know what is going to happen. Health promotion approaches can help alleviate some of the inequities which often impact health in a negative way. And the evidence suggests that good health requires action on the social determinants of health. You notice how often the social determinants of health surface. It is really the platform that should guide what we are doing, especially with health promotion. So when we take a closer look at our current situations, we recognize that vector-borne diseases and lifestyle diseases, much of it is influenced by social factors. And with the advent of what just happened, we have now to be gearing up for a possible dengue outbreak. We also have to be thinking about typhoid and leptospirosis, because typhoid is endemic in some of the parishes. Yeah. Every year we have a few cases. So we have to be thinking about those in the kind of situation that persons are now in. Infrastructure totally destroyed. You talk about solid waste management. It is extremely important for that, for the government to step on that, or your local authorities to step on that, if we are going to minimize any of these things surfacing right now. And how do we manage when persons don't even have anywhere to sleep? These are some of the realities that we are faced with. But in the same breath, we don't want to have that happening, because that is going to be adding fire to an already raging inferno, and we don't really want to have that. When we look at inequities, we can look at what is happening uptown versus downtown. What goes on uptown is totally different from what is happening downtown. The kind of things that persons uptown have access to, those downtown may not have access to it. The kind of things that they are willing to invest in because they have the resources, those downtown may not have the resources to invest in that. The challenge though is that sometimes those uptown do not see investing in those downtown as a means of protecting their own health. I don't live down there, so I want to, but when anything pop off down there, I can tell it is going to climb the road, and it is going to go uptown. But sometimes I do not see it from that set of lens. Like they are down there, I am up here. So the two things never come together. Urban versus rural. What is available in the urban center versus what is available in the rural setting? One Caribbean country versus another Caribbean country. And we can look at what is happening with our Caribbean neighbors right here. What is happening in Haiti? What is happening in Cuba? Where does the rest of the Caribbean come into part of that helping my brother get to the place where my brother needs to get. We know that Cuba is constantly under embargo from the United States, which is crippling their economy to a great extent. There was a time when they were getting a lot of support from Russia, but that was when it was USSR, the United Soviet Russia. Since they have had that dismantling, I do not know the extent of the support that they are getting, because the Iron Curtain fell and there were some countries that pulled away from that union. So it is no longer a union as it used to be in those days. We also have the whole issue of what is happening now with Venezuela. And we better believe that if they start a war down there, the whole Caribbean is going to be a blanket. It is going to have implication for aerial travel within the Caribbean. It is going to have implication for the countries that depend on oil from Venezuela to do their business. Now, what a lot of persons sometimes don't realize, that although they may not be trading directly with Venezuela for oil, the countries like Mexico and probably Brazil also that they are buying oil from, those countries are getting their oil from Venezuela, because what they have as deposit is not enough to serve their own country, much less to import. So they are getting from Venezuela, because Venezuela has the largest deposit of oil reserve in the world. So Trump has sounded the trumpet, and he is down there picking off some boats that are claiming that they are drug traffickers, and warships are down there. Why would the United States government deploy their biggest aircraft carrier down to the Caribbean? It's something that we need to think about.
They control Guyana oil. America basically fully controls Guyana oil, and Venezuela is threatening to take part of Guyana, including the oil.
And so that is what triggered the whole thing.
Their oil. They're not protecting Guyana or the Caribbean.
Yeah, there's that on their side.
Yeah.
But those are some of the geopolitical issue that comes into play. So when we talk about what is it that we need to do to reduce inequities, it's not in a silo that we have to look at what is happening. We have to look at the broader picture and the impact it is going to have. So those of us who are Christian, we need to pray and pray hard that no war don't start down there.
Definitely.
Because every one of us in the Caribbean are going to be impacted in a very negative way. So we have to think about those things. So when you talk about health promotion, we are not just looking at health issues and then we're going to do something. It's a wider, broader perspective that you have to bring to the table. Inequities causes breakdown in relationship, and people are less likely to work together if they don't have that cohesive relationship going with them. Given the fact that health promotion is a cross-cutting discipline, means that it's not just health alone that can do what needs to be done. Efforts are being made to use health promotion to alleviate some of the inequities. And so we must keep in mind that much of what influences our health is not found within the health system. The social determinants of health comes back again to the fore. And so we have to look at the renewal within the Caribbean context, and the fact that at the 30th anniversary of the Caribbean Charter for Health Promotion, and that was the PAO conference in 2023, regional stakeholders recognized the need for the renewal. And so health promotion structures in many countries have weakened over time, and that was some of the issues that they were actually looking at. The fact that non-communicable diseases, climate threats, and inequities remain a major concern for the Caribbean, that there's uneven implementation of the Charter's 6 strategies across the nation. So it would have looked at the 6 strategies for the Charter. Across the region, it is not being implemented in an even way. Some countries are ahead of some in terms of its implementation. And the COVID-19 pandemic really brought to the fore gaps in our communication, the trust within community, and the digital readiness or lack thereof. That is part of what is happening in the Caribbean at this time. And so we need to take a look at the link between the Caribbean Charter and the renewal of this movement, which is the renewal of the health promotion. In the charter, which is the Caribbean Charter of 1993, that's when it was developed. And what is the renewal agenda? We're looking at 2023 and beyond. Emphasis on empowerment, supportive environment, and alliances was a part of that Caribbean Charter. So there's now a renewed call to strengthen social participation, digital advocacy, and governance. We are also looking at the regional response to the rising cases in the non-communicable diseases and the fact that when you look at the renewal agenda, there's an expansion to climate health, digital health, as well as equity. When the added focus on the media, which is a part of that agenda, was looked at that charter, we recognize that there needs to be a renewed focus on the social media and the digital storytelling. A lot is happening on that platform or those platforms that can either hinder or enhance what we need to do. The regional adaptation of the Ottawa Charter, we will look at the fact that there needs to be the realignment or the alignment with the global framework like these SDGs, and also implicit emphasis on sustainability. We can't underscore that enough. And so the explicit inclusion of sustainable financing and intersectoral evaluation is all a part of what we need. And so you find that with the 2030 agenda here in Jamaica, I know that the Ministry of Health has to submit a report on a quarterly basis to the committee that is spearheading the implementation of that particular development agenda. So everybody who have all the stakeholders in it, and so they need to start at the table to see whether or not the things are rolling out the way it ought to be rolled out, and what needs to be done where gaps are. There are a lot of gaps in health, and I don't know how they plan to fix them, but I hope the fact that they are sitting at the table and looking at it, it is not just a meeting for the sake of meeting, but meeting with a purpose to do something, to actually have something actionized to fill the gaps that would have been identified. So the regional priorities would include the reinvigorating of the community empowerment, which goes beyond participation to genuine ownership. What we really want is for the communities to be so empowered that they take ownership of. Because we really don't have the manpower to be there at all of the community levels to really spearhead what needs to be done. So the communities need to take on that ownership. There needs to be strengthening of the intersectoral action, because we really want to embed health in all policies as part of our national planning. And we need to harness the media and the technologies that are available, particularly for our youth as we engage them. That's the only platform we're really going to find the youths. And even when they are in universities studying, you find young people don't even really visit some of the platform that provides them with the information that they need to even sometimes do well in school. But they are on the TikTok and all of those things, and anything on TikTok is gospel. Another thing where the whole business of the media and technology is concerned is that sometimes you may have some particular professional discipline that, and let me not say that, let me be specific. So for example, you may have like our doctors. They would have been out there practice. What they need to understand is that we are living in an age where patients are going to be coming in because they cannot write the prescriptions themselves. Because they would have gone to Dr. Google, they would have done their research, and they would have looked at the kind of medication that is required to get them back to that state of health. So when they come into you as a medical practitioner, they are going to be telling you what is wrong with them and what they want you to prescribe. How do you handle a situation like those? Do you throw them through the door and say, I am the professional, and if you're going to be telling me what to do, then go ahead and do it yourself? Or you're going to be using it as an engagement platform? Have discussion and dialogue with them. How did you arrive at that decision? And they're going to be telling you where they get their information from. So you engage them to know where they have gone to for their information. Now you can't throw them out the door with the information, because when you were in school, where did you consult to write your assignments? And if that information was incorrect for them, it should have been incorrect for you too when you were doing your assignments. But in the middle of all of that, we have to understand that there's also misinformation on those platforms. So when you engage them in that discussion now, you find out whether or not they are getting their information from a credible source, and you take it from there. So we talk about the old business of engaging, especially the young people. Because gone are the days when they just come to doctor, like old people like myself, and whatever the doctor tell you is gospel. No, everything you know is being questioned.
For them to ChatGPT tell me this.
Yes, ChatGPT give them a whole lot of information. So we have to be at that place in our engagement with them where we recognize that they are not coming to us as blank slates, but they are coming with information, be it correct or incorrect, and we need to have that dialogue and that discourse with them. So we talk about the whole business of renewal of health promotion. That's a part of what we have to now say to our practitioners, that remember that these things are happening. How do we embrace it and use it for the advantage of the patients? We have to get to that place. When we talk about building sustainable financing for health promotion, we need to structure it in such a way that what is happening is not ad hoc. And too many times, some of our campaigns and our financing depend on external forces or sources. If we depend too much on external sources, there's going to come a time when that is going to dry up. And a very typical example is the HIV program. When those started here in Jamaica, they were all externally funded. It started out with the Germans, with the GTZ program, and then they moved to USAID and UNAID. Now these the German program pulled out a long time ago. The USAID and those programs have been there for a long time. Now Trump is in office. Trump asking a whole bag of questions and can't get no proper answer. So you know what I'm doing with those organizations. Him say, look here, no more money than I get. And especially in light of the fact that quite a number of those organizations are the source of funding behind things that are being done for the at-risk group, the men who have sex with men, and the gay agenda. Trump not in and nothing with that. And he used that as his reason for just cutting the funding. What was that?
Oh no, I'm just saying the cutting of USAID is still not necessarily a completely bad thing, but that's a more political argument.
Okay, that's debatable, and I take your point. But
No,
It's
I
a
mean,
bad thing when the government, hold on, Walter.
It-
It's a bad thing when the government has no intention of taking on any of what was being done. Because I can tell you, Global Fund was supposed to pull out of Jamaica from 2020. Because of COVID, Global Fund decided that they were going to continue. And when they eventually decided that, because the plan was always that the government would take over much of what Global Fund was doing in terms of social support for Jamaicans, the government has not taken it on. So
that's
currently,
exactly
if you
what we're
ask anybody,
saying.
even without USAID, because this is new, this is since January. So even without that, since Global Fund pulled out at the end of 2022, much of the programs that we could have done for patients, we are no longer able to do. And when you ask the government, they are not filling the spots. In fact, it was some of the same like CDC funded partners and CTEC who ended up trying to take up some of the slack from what that fell off from Global Fund. So that's the problem we have. The government is refusing.
And that's what we're talking about.
Even when you think about staffing, even staffing, things like evening clinics, some of those very evening clinics that you are seeing for HIV. I can't speak specifically for HIV because I know it's still being funded by external partners and the government. If the partner them stop for 2 months and don't pay, it's like the government don't lost and they don't have no intention of paying for anything, which cannot be the case.
And that is exactly what we are saying, is that there needs for there to be the building of sustainable financing. And we know that that is not in place, because even with Global Fund, many years they have been talking about the fact that Global Fund would have given them a deadline within which they are going to pull out. And so they were supposed to put position in place to absorb the staff as well as take on the other things. And they had years to do it, and it was not done. So here we're talking about some of the challenges that we have in terms of even the renewal of health promotion is a lack of sustainability of financing. I have had the unfortunate experience when I was working on the field, when I was in St. Catherine, where we had World No Tobacco Day was always funded by PAHO. And we know exactly how much we were getting from PAHO. So I would have gone into administration and they would have said, yes, go ahead and do the planning. And we will put the money up front until we get that reimbursement. Because for PAHO then, you have to execute, submit your report, and then they release the money. Everything was in place, well planned. The day before the event, when I went to administration to get that $5,000, and then time the $5,000 enough money.
Remember?
Yeah, I have enough money them days. It's not like no. To execute the activity the following day, they were going to tell me that they don't have any money. And I'm dead serious. Everything was mobilized. I actually had to go into my pocket to do the activity. And they did not give me my money back until they get the check from PAHO. And I kid you not. But oh, do you let something at that late stage go down the tube? You have to look at your credibility that is going to be on the line. And you can no longer have that partnership with those groups. Because they're going to say that, oh, after you plan something the day before, after them do everything, I mean, everybody ready. So sometimes as healthcare workers, we are placed in that very uncomfortable position because they do not build sustainable financing. And they talk about health promotion being the platform on which a lot of things should be done, but they are not funding it the way it ought to be funded. So the realities are there, and I understand where you are coming from, having worked many years on the field and having been subject to what you are talking about, where we have difficulties getting funded. We also need to monitor progress through measurable indicators that are aligned, as we said before, with the sustainable development goals. So while the challenges are there are also opportunities that we can actually look at in terms of the renewal of health promotion. So there will be factors that support health promotion, and the converse is also very, very true. When we look at challenges, the first one we can take a look at is disorganized urban growth. Anybody want to talk to me about that one? Disorganized urban growth.
Everybody wants to be in Kingston, and now they're just putting high rises in areas that were not originally accepted for high rises. So you're having a high rise next to your normal flat house. So
you didn't have no privacy anymore.
No privacy. Some of the areas are actually protesting against it, but the high rise, people have money. So they keep getting to go through. Because multiple times in here where there were like stop orders for like a short time because the residents protest, but then in the end you still see it go through, like it never actually got canceled.
So money makes the mayor go around. And in addition to those high-rise buildings going up, the infrastructure that is needed to keep pace with them is just not there.
Look at traffic.
Oh, sorry.
So,
Yeah. That's what I was going to mention in terms of the high rises going up. Thinking particularly along like what you want to be called Wellington, where it is just going to have a lot of persons living there, going disparate places, and everybody's just going to have a car for themselves, and it's already just kind of a congested road as it is. The air quality is going to be poor, the quality of life is going to be poor because all the traffic that's going to be there is just going to be miserable.
And the drainage system is not set up for the number of buildings.
So that's why they dig up the road and put everybody out on the other road. What I think where these successive governments have not done is proper forward planning. So we know we are living in an era where people are living longer. So the old people like myself not dead so far, so they pick them get the house. So they are going to need to get their own homes, right? They have to get somewhere for themselves, and the grandparents them have to get somewhere for themselves because we are living a little bit longer. So there was no forward planning to cater for that. And so you find that even when they put in the drainage system, the sewer system, it was then designed to cater for just the population. At that time, they had not looked forward to see that there's going to be an increase in the population, an increase in the demand. And so you find that now that they're putting up some of these high-rise buildings, the current infrastructure was not designed to carry this capacity. And so the problem now exists. That is what is going on Monroe Road now, or Wellington, whatever that road, I think it's Wellington, because you have several high-rise buildings that are going up on that particular road. That sewage system and the pipeline wasn't designed for that volume of usage. So it is no longer going to be able to manage what is going on there. So those things are happening when you come to the disorganized urban growth. Those are some of the things that are actually happening. So they have to put in sewage system. If you look even at the Kingston Public Hospital, it was designed for a particular population level. The volume of usage of that facility now way outstrip the facility itself. Yeah. They don't have enough beds. So even like when you had like the COVID-19, they never have enough beds to collect the patients. When Melissa was coming, you know that normally when you're having disasters like those, the hospital do a lot of discharging. And a friend of mine, her sister, who apparently had some gallstone kidney, some such related matter, went to the hospital the Monday. She was sent home the Tuesday, and she died Tuesday night. Just like that. The family is distraught because they're saying that the hospital ought not to have sent her home because they told her that she needs surgery, but they still send her home. And one could understand and I'm trying to help them to understand that with a disaster threatening the country, there are some hard decisions that have to be taken. Unfortunately, there was a demise in the middle of all of that. But they would not have been going into or planning any surgery at that particular point in time because they have no idea what the impact of the system is going to be on the hospital system. And we have to have an appreciation for the fact that the hospital, even when they're in crisis, they are still a responder because they must respond to all of the casualties that are coming into them, even when they're trying to cope with the impact of the system. And sometimes as citizens, we don't understand that. The only thing we can see is that it is hospital, and my person sick, I need to go there, they need to go there, and they must be treated. So we have to try to help them to understand that it's no comfort, but that is the reality. So we have some of those things here where the population now has outstripped to a significant way the resources that are available. How do we catch up and then keep pace in going forward with what is happening? So we are faced with some of these. And as you would have said, Daniel, it has impact on the health of people because the amount of dust that is on that road and all of those things, that you can imagine the houses that are on that. Every day the dust, and before you're finished, the dust is back on the furniture. If persons have respiratory illnesses, the impact it is going to have on them. So we do have some of these things happening, and it is impacting health. So it goes right back to the determinants of health. What determines people's health? What is in their control versus what is outside of their control? Policies sometimes do not adequately address the root cause of people's ill health, and the multi-sectoral action is always required. And because of a multi-sectoral challenge, action, it is a challenge because sometimes everybody is coming to the table, but they're not working together. So they're sitting at the table about each planning, what can I do in my little space, because it's a matter of who is going to get the accolades.
In environmental health, now we have the panel. They gave a clear disclaimer that even when they come to the table, all they can do is give suggestions. And at the end of the day, the suggestions, like they would suggest that they don't think that high rise can go there, it's not acceptable. Therefore would agree with them. Solid waste might agree with them, but then when it reaches to the politicians who are friends with the developers, all they could have done is say they write up their recommendation.
And that's the most that they can do. And the example that we can also draw on to is the whole issue with the fish killing, the recovery, and that cooking up behind the scene, and the outcry, and they had to come back to the table. So I don't know how much the company actually end up paying. But certain sectors just never accepted that behind the scenes settlement that in no way could have helped in terms of trying even cleaning up the disaster that was there. So you are correct when things reach a particular level. So again, it goes back to the political will. Though we may not want to work with them, they must be a part of the agenda because they bring a lot to bear to the table. So sometimes when they do meet, and then when you have the multi-sectoral, each organization is coming to the table, but they are thinking about what can I get out of this? When we come to the table, we sometimes don't see that partnership and collaboration as everybody sharing in the glory. Some persons do not wish to share their glory. So they want to say that it was my organization that did this. And so even though they sit there, that silo thinking is still going on in there. And so what should have been a collaborative effort sometimes is not really collaborative, and that can be a challenge in terms of the renewal of health promotion. And again, poor communication among sectors. Sometimes that communication that needs to be happening don't happen in a timely manner, and it can also trigger issues. Powerful influences of some industries, and you'd have mentioned where the political people can come to bear: tobacco, alcohol, and food. And we would have looked at what was happening or what is still happening with our foundation and the packaging of front of label packaging, and the fact that they are adamant that there has been political interference and they were not afraid to call names. They actually did. So she was very fearless in terms of coming to the board. With tobacco, when it was supposed to be passed into legislation here in Jamaica, I remember a member of parliament saying that he had no problem with tobacco legislation, but he had a problem with some of the things that were in the legislation. And one of the things that he had a problem with was the fact that they were saying that smoking should not take place in the homes. And they did that against the backdrop that children are there and household helpers who need to come in, and their exposure to the second and third hand smoke. And he said that his home is his private space, and he's supposed to be entitled to do whatever he wants to do in his home. I was a politician. No, that now get passed nowhere unless that was addressed. Eventually they had to take out that clause out of it. So we talk about the political will to get things done. The entertainment industry and some of the songs that they put out that would hinder what we are doing, and I use those examples, the gal in a bungle and me a rub on me bleaching cream. Yes, some of those things. So when you have the entertainment industry endorsing the unhealthy behavior, and the people see them as their idols, it's a part of their entertainment, it's a part of their identity, it's a part of what they are doing, it is going to pose a problem. So these things are going to hinder the whole business of what we need to do. The lack of evidence for the effectiveness of healthy setting approaches, and we have lack of evidence because we are not doing the proper monitoring and evaluation that needs to be done, so that we have the evidence to say this is the outcome. And so it's struggle is real to promote healthy behaviors when you are going up against industries that has money. It was not easy to get past Carreras with the tobacco legislation. There were many meetings. There were many meetings. It was not easy to get past them. They can influence through different means from the policy level all the way down. We see them sponsoring all kinds of events, especially poor sporting events. And when you have, well, the summer thing that usually happen in summer, everybody, young people get out during the summer. Dream weekend and those things. They have booths that they set up at these different events. And those booths, what they are giving out is free. It's not that anybody had to buy them. The alcoholic beverage companies do that too. So them have free access. So after they tantalize and stimulate your taste buds, then you are now going to be willing to go and purchase. And so part of what they had to look at here in Jamaica is that tobacco industry no longer be a stakeholder in funding any sporting event. But having said all of that, we start to tax them and take the money from them and put it in a little space where we say we have access. Is what is the Chase fund? It is funding. So Chase fund is getting money from the tobacco and the alcohol industry. That's where that funding is coming from. So if we are going to tell them that don't sell it, then we're going to take some of the money after them sell it. I don't know, but that is what is happening. In some regards, we do not have enough research or even evaluation of programs, as was said before, but I'm happy to say that we are looking really a lot more at research. What we need to do is to get those research out into publication. And over the years, the Ministry of Health would have been having what they call a National Research Day, where research persons who are doing research are invited to come and share what they are doing. But it's only a small audience that really have access to that particular bit of information. So we really need to go into publications. Hence my cohort here, that I am hoping that every single group will make at least one publication from the research that you are doing. And we are serious about that. And I'm sure Dr. Thompson would have spoken to you about it. So we really want, it doesn't make sense to come and do all of that work and just sit down and just gather dust. Let your name go out there, man, so somebody can see you and say, oh, you know, I was looking at a paper that you published. Yeah, we're going to get the accolade. So let us put it out there for others to actually see. You do invest a lot in doing those theses. They need to be out there. In the middle of all that is happening, we still have opportunities that we can actually work with. And so we can look at the adoption of the 2030 agenda for the SDGs. And this agenda for sustainable development is an important shift from disease-oriented development to addressing all sectors. And we look at the whole business of the economy, we look at the environment, and we look at social development as integral part of what we need to do. So there are 4 strategies for the renewal of health promotion, and these were outlined by POW in 2019. They speak about the re-energizing of key healthy settings. They look at ensuring community participation and empowerment, as well as the engagement of civil society. They look at how can we enhance good governance and intersectoral work and address the social determinants of health and strengthen the health system and the services through health promotion. And we are going to be looking at those in detail. So when we talk about the re-energizing of the key healthy settings, key settings that should be in universities, the communities, the workplaces, the hospital, our health centers, churches, prisons, markets, you name them, and we need to have a look at them. Why? Because we're talking about where people live and they work and they play and they do all of these things. So that is a setting. So we have to adopt the settings approach. But this needs to be systematic in how we do it. So we want to enhance or establish healthy settings, networks, and initiatives, because that will help us to build capacities at all levels to implement healthy setting guidelines. And when we look at the settings approach, there's an assignment in health promotion too that is always given where you actually have to do that assessment of a facility. We have done markets, we have done schools, we have done workplaces, we have done health centers, we have done hospitals, and we have also done even restaurants. What was the offering that they actually have? So, and we have done churches as well. The prison now is not easy to get into, but I do believe that we do have 2 persons in this cohort that actually hails from that workplace. So we may just jolly well look at that one because they already have a footing. That's where they work. So we might look at how it can be built out into a health promoting setting. So those who are from the prisons, I'm just giving you a heads up that might just be on the agenda for our next health promotion too. When we talk about ensuring community participation and empowerment on civil society engagement, we really want to ensure that there's participation, that a community should be given the right as well as opportunities to make effective decisions regarding issues affecting their lives. There is conventional wisdom in every community. Means that the people already understand the issue and they also sometimes know the solutions to the issue. They just need a little help in advocacy and networking to get it done. If you have that discussion with them, they'll tell that boy, we think that if this and this get done, then you can solve this. But sometimes it's not they don't have the wherewithal, it's that they don't have the supportive environment to do what needs to be done. So I really want to empower them because this is really important and they need to be a part of the process and continuous assessment of the community to provide the support that is needed. We have a tendency where we just sit in our office and we want to plan something and go and we just go. We want to move away from the dependency and the mendicancy. We want community members to say, hey, we can do this for ourselves. Just give us a little support. But often we just take things in there and we do this handout and when we come out, the people will say, hey, they were not a part of it. So that interest in its maintenance is not there. So we need to move away from some of that. We want to look at a more meaningful engagement with civil society because this is needed if we are going to really make an inroad in terms of improving health promotion. So we need to develop specific programs and materials to promote informed and empowered population. That is one of the reasons why you find like in the Jamaica Moose program, they work with the Ministry of Education and they work with other organizations. And I want to tell you that out of that particular interaction and the multi-sectoral approach that they would have used, things were happening. The youngsters were doing their gardening at school. They were having like their water day or their fruit day. So the youngsters were enthused and they were doing things at their level. But then there came COVID-19.
Before that, you were the scandal first.
Huh?
You were the scandal before the COVID.
Well, the scandal never really impacted so much because when big people something that. But that was big people something, but in terms of what they were doing on the ground, and even when we started with 100 schools as a pilot project, and there were schools that were calling, asking if they could be a part of it, if they were not selected, even though they were not selected among the pilot, because there was a healthy jealousy because of what was happening in other schools. So we had some of those things that were happening. And if you have a good program that is showing impact, others are going to want to be a part of it. But COVID-19, that young man, I'm not calling him a girl. No way. Melissa is enough. You're not calling that one a girl. No, 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 no. When we look at the whole business of good governance and intersectoral work and the whole business of addressing the social determinants of health, we need to address issues that exist between the population needs and the response from the health sector. And we have to remember that there's a thing called felt need and normative needs. Normative needs tend to come from the persons who are working in health. We look at the epidemiological data and we make an assumption as to what the needs are. But the felt need is what the people themselves think that they need. And there's a difference between the two. And too often is the normative needs that drive things. And then when we don't get the cooperation and the participation that we need, then we complain. But if we had those felt need as the driver, they would have gotten a better response from the people. We also need to create synergy between health promotion, the social determinants of health, and people's human rights. We can't leave those out. But even when we talk about human rights, sometimes people will say that the government is high-handed and some of the things that they do, but it depends on what is happening. There are some things that are going to require an authoritative management style, and something that can be open for a democratic approach. COVID-19 could not have waited for a democratic approach. So it depends on what is actually happening. Some things may require a change in management style to address it carefully. We need to build the capacity of the professionals with responsibility for health policies to support development of goals across sectors. So if we get one minister of health who don't have a clue about any of these things, we never get anywhere. At the local level, if you are planning your thing and you don't keep HR on account, and the account department and that planning team, you're going to have problems. So here we're going into the workplace, talk about workplace wellness. And HR was not involved in a lot of the organization in terms of the planning. So when it was no time for them to give the workers the extra 30 minutes off work early, so it can go participate in the exercise. It wasn't happening in many regards because HR never understand the whole business of the impact of workplace wellness and productivity. So when you're going to be forming those committees, and remember, health promotion is not about no one-man band. It is working as a team to get things done. So whenever you're planning anything in your organization, 2 team members need to be on your planning team. Those from HR and those from accounts department. Accounts don't like spend money, even though it is not coming out of their pockets. They do not like to spend money. So if they are not a part of that planning process and cannot see the need for that investment, you are going to have problems. I even think it's what we're making. Try it.
Whatever product is not their money.
But they are the ones who sign off on the documents.
Even if they get like a sponsor, they feel.
They are the ones who sign off on the documents, and if they don't understand the need, you will have a supplier waiting 6-7 months to be paid after they would have given their service. I remember working with one facility, and we needed something as simple as an electric kettle. It now costs more than $1,500. It took us months to get it, and we needed it because we were having a GE outbreak. And when the children are coming to the facility, you need to make sure it's clean water using to reconstitute the ORS to give it to them. It was a struggle. $1,500. We have to back up the little accounts man and give it to him one day to get the little money to go buy the kettle. So it is very important to have them as part, because when they're sitting at the table, they will hear quite a bit and they understand their role as a part of the process. So sometimes we plan them out of it and then we expect them to just come and support. No, just like how we are planning with the people for the people, plan with your HR and your accounts department.
The legal too.
Hmm?
Legal too.
Yeah, plan with them. And make sure that when they meet, they're not scrolling on their phone, they're listening to what is happening. Because some of them will tune you out, you know. They must literally tune you out. So they are there. The body is there, but the mind is not a part of the meeting. So you have to work with them. So call on them. What is your suggestion? How do you think we can do this? You let them be integrally involved. So it's not just the target population, but also the members of their stakeholders as part of your team that needs to be there on board from day one. There needs to be strengthening of oversight responsibility at the regional health authorities and at the Ministry of Health levels to address the social determinants of health. It doesn't make sense we're down on the ground doing things and it's not coming from the top, because at the end of the day, they are monitoring and evaluation, oversight. And so whatever we are doing there must also be in keeping with the national objectives. So as a promotion officers, what I would do when I was working as a regional person was to call into the ministry, what is the focus from the ministry perspective for this calendar year coming up. And then we look at what is happening at the local level and we do the bridging of the gap. So that at the end of the day, all that we are doing is also feeding up to them, but it must also be helping them to achieve their objective as well. So they have to be that communication and that working with at all different levels. We need to provide a comprehensive approach to health and health care. And I think some efforts are being made in this regard. And policies must be developed or strengthened to reduce inequities and inequalities in health. I think they are trying, but we have a long way to go. But they are actually trying. When we look at the strengthening of our health system and its services through health promotion, health must be viewed as a right and kept at the center of the planning, and the sector must expand beyond responsive care through clinical and curative services to increase health promotion initiatives through national policies as well as guidelines. So we may see a lot of initiatives coming out of the different health centers that are at the different levels. You may not see a health promotion specialist per se, but because other members of the health team understand, then they know the roles and function and the things that needs to be done, they are part of the process because you don't have enough health promotion specialists to be in every facility to carry out the task. We also have to conduct community-based assessment to determine impact of health promotion policies on community health. So we can't just sit there, we also have to work at the local level. So if you're going with a program and you're the health education officer saying that they're going out to do a needs assessment or a feasibility, so there are SWOT analysis, they're gathering the data. Because sometimes we get the epi data, but we also need to know what is driving what we are seeing in those areas. And unless we can find the root cause, then whatever programs we go with will not solve the problem. Because at the end of the day, we are seeing the things at the top of the tree, but we need to see what is going underground to be fueling the growth of the tree that we are seeing and the branches at the top. When we look at the health system, the health services need to be culturally sensitive and facilitate collaboration across sectors. There was a time when the young people couldn't come into the facility and get certain services because of healthcare workers' biases, like family planning. So them out there, they have sex and they're not supposed to be having sex. So we tell them they're not supposed to have sex and we attitude just turn them off. So the unprotected sex are going out there and some may get infections and some ending up being pregnant. But if you look at the whole social determinants of health and understand that we need to do what we need to do, we gave me family planning when they come because it means then we won't have a problem with teenage pregnancy. And sometimes when you have this dialogue and that discussion with them, it's not that they want to engage. But sometimes their situation and their circumstances is what forced them into the position that they are in. And because they are minors, they don't have that negotiation power. Sometimes I write that the household the things that come from. And I tell them that their parents have to give consent when it's the father molesting. Or they're going to get that consent. And the mother don't believe them that the father touched them. Where are they going to get that consent from? And so we have to look at a lot of issues. And I remember one year when the government was trying to develop a policy where it's that a 10-year-old child should be able to come into a health center and access family planning without parents' consent. And the healthcare worker said, not over with dead body.
I mean, I agree with the 16-year-olds without consent.
They had it at 10 years old, and it was a particular program that was going on that emerged out of the HIV program, and that's what they were pushing. And the healthcare workers said, over our dead body, this one not flying. And they asked him, who is going to provide protection for us when the government come down on us to aid and abet what is on the book as a criminal activity? And so you wonder about what was going to, well, their justification for it was that some of them are being molested in the household, and so they would not be able to get any consent from those within the household to prevent the pregnancy. And I understand where they were coming from. But as I said to them in that meeting, we are addressing the branches. We need to get to the root. So if the child coming at that age, then we need to call the police. No questions asked. Call the police. Because that child will need to be protected from that person within that household.
And we could be fined if we don't report
as medical professionals. So that was one of the things that they were saying. So how do we manage this? Who is going to protect our back when the lawsuits start to come? So that one never get anywhere. I never forget that meeting. It never go anywhere. The care workers shut it down immediately. The thing is that we have a lot of laws in Jamaica, but they're not supportive of each other.
Yeah, because even when we report and so comes, when we check back on patients, it's like nothing will happen. But even sometimes, for example, it's the same age, right? And you understand it's still an offense, but it's the same age. So you understand nothing really coming up that. But even when it's big men, when the little girls tell us it's some big man and it's from the community and nothing will happen. Sometimes all the person come with the child when the 40-year-old delivery, you see the father show up quite comfortably at the hospital. And it's just so
but we have been seeing a shift though, because more and more of them are being brought to the books now. before the courts of law, and they're actually
So that is what I was gonna say.
right.
A lot of them, so even though at the time when you come on, you may not see anything happen, it is happening in the background.
Mhm.
So the police is called, and another time, I actually write up the documents for the police. And I've been getting more and more tips for them to do it.
And you have been seeing more and more in the media where they are being imprisoned for those actions. So there has been an increase with regards to that. It is slow, but it is still moving along a positive direction. So we are getting some of those things. So we have a lot of laws, but sometimes they don't strengthen each other because adulthood is 18. At age of consent for sex is 16. Two of them should be one and the same age.
When it's not the same age.
No, they are not.
Why?
I don't know. It
Not
depends
there.
on who make the laws, you know. So
There,
yes,
me,
Daniel?
sorry.
I don't know. It's like and again, not necessarily trying to like die on this hill, but at the same time, I think isn't the 16 aging, isn't that more so supposed to be for, I guess, when it is that they're in their own age group in terms of relations between their own age group, as opposed to like, I don't know, conferring adulthood and that kind of
It's
stuff.
the age of consent to say, yes, I can have sex. And the young girls, then say they don't want nobody will get lunch money like themselves. So it's not within their age group. Yeah, they tell that they don't want anybody who's getting lunch money like them.
No, but there is an aging consideration though. There's actually an aging consideration as in age differences somewhere in there. But one of the things that I wanted to say is that even though, you know, we also have an issue because even though the law says we keep on saying age 16 is the age to consent for sex, but it's not limited to consent for sex, you know. It's the age of majority, which also means that 16-year-old can consent to medical care. So if they need to go to the dentist, they can go to the dentist on their own as well. But we also have a problem because even though the law says if I'm 16 and I want to see the dentist, I should be able to go to see the dentist by myself. There are some places that you'll go that nobody wants to assist. Even though the law says at 16.
I know that they are not allowing them to sign no form at age 16 and telling them for their parents.
But the law says that the child can give consent to even surgery at the age of 16. And it's a recognition that they can have the cognitive ability to make that kind of decision on their own even without a parent. And depending on the 16-year-old, they really have that cognitive ability to make the decision. And we need to accept that is possible. What we need to do is provide the guidance. Now we also have a problem on the other hand. How many 16-year-olds can walk into a sexual health clinic? A comprehensive. If I see a 17-year-old, I see them by themselves. In fact, sometimes I ask the parent to step outside so I can have a conversation with the 17-year-old who has made this decision. And so I can give them proper guidance on the decision that they've made.
Part of the reorienting of the health services
in the conversations, and sometimes the children don't give you all the information you need to get because this person is hovering over them in the corner. And we need to understand that whether or not we provide the space for them to come and supportive team to give them the advice and the support, they're going to have sex and then we're going to be in bigger problems. So I prefer if the door is open and they know that they can come and they're going to get the services that they need and the support that they need, rather than they're out there and they're just doing anything and they're getting everything. Because remember that 15 to 19 age group is the ones running this HIV epidemic. So if we don't have the conversations, if we don't make the spaces for them, we're going to be in trouble. We can't not do it.
Part of the reorienting of the health services was to make that space for them, and that is why you are now able to do some of the things that you are doing with that particular age group. There was a time before when doesn't make any sense. They walk into a healthcare facility, nobody was going to be seeing them without their parents. But the recognition was there that the services were not user-friendly, especially for the particular age group, and they look at the nuances within that particular age group, and that is why they would have put that policy in place and now make it possible. So even if at 16, the child comes in and want to have access family planning, the care worker is not supposed to say no. They are supposed to have access to it. Some years ago, that was not so. You couldn't walk in there under 18 and get anything. Trust me, them lunch you good and proper, and when they finish with it, you're not going back there all when you're 20. So we have some of those. So those were some of the reorienting. Pardon me?
Then again, now, like Nicole was saying, you have multiple laws and you have laws in contradiction, because then that which governs schools does not say that you can give those students 16 or otherwise any family planning.
Not in the school setting.
You're
but if they
forbidden for
come
doing
into
so.
the healthcare facilities for it, then that's a different space. But you could not do that within the school setting. And that was
Even
one of
as
the
the
challenge that
same
the
healthcare
HIV
worker.
program team members had, because when they go into the school, they weren't allowed to issue condoms to the youngsters there. But if they go into the health facility where they themselves go to seek it, then they are not to be turned away. So it was the setting now that they are going to be seeking to access that service that was going to become critical and important. Yeah, so we have those issues that we are dealing with. And so we need to train our health workforce to develop or increase their skills in navigating the treacherous waters, especially with our youngsters. There are some other things that need to be considered. We need to look at focus on holistic well-being. So we need to promote things like mental health, people's emotional, physical, and social health as being interconnected parts of the overall well-being. And as I would have said before, I noticed that mental health is now very much on the front burner, and they're making issues to look at it. So even with the devastation, I remember hearing in one of the press conferences where they were talking about efforts to address the psychosocial well-being of the persons who were affected by it. So that things are happening. It's speed that we should have liked to see it happening, but the journey of 1,000 miles begin with what? The first step. So we are stepping in the right direction, but we have not yet reached a destination where we want to be. We also need to encourage mindfulness, stress management, and mental health awareness alongside physical health. And stress management is a very important factor, not just for the clients, but also for the healthcare workers. For what?
Manage stress.
Everybody can manage stress. It's really our response to the situations, that cause us to be stressed. So if we can manage our response, then we can manage stress. Seriously. But all of us goes through stress. There's nobody that is exempt. Whether they live uptown, downtown, or in between, it's common to everybody. And management of stress is a part of the whole mental well-being of the patients. And I know that over the years, doctors would have been encouraged to look at the mental assessment of patients as part of their routine management of the patients. Emphasis on community engagement, we can't underscore that enough. There needs to be collaboration with the communities to design culturally relevant health initiatives. It must be something that they are willing to embrace. If not, you are going to waste your time. You go there, and they listen to you, and some of them you are there talking, and they close their ears, and they see your mouth going up and down like this, and they're not hearing a thing because they have closed their ears. And so we need to plan with the people, for the people. And in doing that planning, we are going to be now using a participatory approach to ensure that inclusivity and equity is on the board. When we look at integration of technology, we want to have leverage with the digital health tools like mobile apps, telemedicine, and wearable devices. So we know there are some wearable devices that persons will have been buying on Amazon, or other platform, and they are using those. The mobile apps are there. Telemedicine seems to be getting traction these days. And I know that some of our health facilities do some telemedicine. I think like Bustamante Hospital, they have, I think it's every Thursday afternoon. They do telemedicine where they connect with some of the experts from abroad, and they do case study discussion so that the management of the patient can be as optimal as possible. The mobile apps are there, we know that some of those. And with COVID-19 telemedicine too, we're now at the place where a doctor can call in a prescription and you can go pick up your medication at the pharmacy rather than having to wait to go in and get the paper and go in. So we are making some strides. Granted, they are sometimes slow, but we are making some headway where that is concerned. And we have wearable devices or things like pacemakers that can be implanted to help with the whole business of the function of the heart for persons who have cardiovascular issues. Using social media platform for health education campaign, we have to look at how we can engage our audience on these platforms because that is where they are at. So we need to meet them and we need to know which age group is where. So we know that the old people them is where? Facebook. And when the young people them there? Instagram and TikTok now is a mixture of everybody. The young and the old and in between is on TikTok. You know what it is about TikTok, but they're on TikTok. Strengthening the system, we'll talk about training for healthcare providers to prioritize preventive care and to address gaps in health infrastructure and the services. And when it comes to the whole business of the behavioral strategies, we really want to use evidence-based approach like nudging, peer influence, and incentive programs. And we encourage long-term lifestyle changes through education and provide a supportive environment. What time do we have time for this class activity? What time is it? Oh, okay. All right. So you're going to be taking on this. And you need to try and see if you can do that. Share ways in which you think renewed health promotion strategies may be incorporated into management decisions and our programs to enhance health. Any suggestion? We can do it as a whole class. Do you see where health promotion can enhance what you are currently doing?
Yes. Cooperate, if they buy in, like in the health relief model, and see that it's important to them, then it'll be easier for us when we come. Especially like simple things like getting 2 blood donors, no matter how much we chat in the health sector and at clinics, please get your 2 blood donors. Everyone comes without any blood donor, the age be of 7 and 8. And then they encourage us when they can't get their surgery because there's no blood in the blood bank to be reserved or prepared for them. So we've been trying to educate them on how important it is to have these blood donors and the risk because every single delivery, anything can happen. So that's just an example.
Okay. You can think of other examples as well. So renewed strategies for health promotion, re-energize key health settings, ensure that community participation and empowerment and civil society is engaged, enhance good governance, and this is like a summary of what we had discussed, enhance good governance and intersectoral work and address the social determinants of health, look at how we can strengthen the health system as well as the services that are offered to health promotion. When you look at other actions for renewed health promotion, policy advocacy, is one we can look at. We need to support the laws and the regulations that encourage healthy living, such as smoke-free zones, reduce sugar content in products, and herbal planning for active lifestyles. And when we're doing even the reducing sugar content in products, we have to engage other sectors like Arada, who can teach persons how to bake their cake minus sugar. And sugar-free cakes don't taste fresh. And that's what some people don't understand. Right, and like raisins. What?
What do you use for the
Do they use like sugar alternatives?
No, simply no sugar in it.
Like
And some of the ingredients are already sweet. They do have some amount of sugar. So you do find even some bakeries now when it comes to Christmas. And so they talk about the sugar-free cake or the sugar-free bun. And I tell you, they don't have hands to sell the sugar-free ones. People just have a way of gravitating towards those. I don't know if it's out of curiosity to see what it tastes like, but those tend to go faster than the other ones. So those are some considerations that you can actually put on the table. When it comes to public education, you launch new campaigns focusing on emerging health issues like climate-related illnesses, digital addiction, or food sustainability, capacity building. We look at the training of our leaders and volunteers to serve as health ambassadors in their communities. And the Jamaica Moves in School was one such example that we can draw on, where we did train ambassadors within the schools. We had 2 teachers from each school and 4 students, and they were the health ambassadors, and they went back. They had their healthy lifestyle clubs that were formed, and they were doing a lot of activities. Trust me, it was heartening to see that they bought into it and they were just running with it. Resource allocation: direct your resources to the underserved population to reduce their health disparities. And I think the government is really doing some of this with the national health insurance and putting onto the health insurance a lot of the VEN list drugs, so that when they go to access those, the amount of money from their pocket is really very, very minimal. So some of this is being done to help to reduce the disparities. But when you come to the hospitalization, some of the surgeries too, or some of the diagnostic assessment, persons are still being asked in many regards to go outside, source that service and bring the information back to them. So we have started the process, but we still have a long way to go. Research and innovations: invest in understanding the current health trends and their solutions and adapting them to diverse populations. So for everybody who passed through this program, I've been exposed to doing some research that can help to guide policy and intervention programs. So in summarizing, renewal and health promotion is the number of reasons to include inequities in the health system, social determinants of health that are responsible for much of the ill health that is being experienced by our population. Health promotion has been found to be able to positively impact the social determinants of health, and we need to identify the threats to renewal of health promotion and devise strategies that can be used to minimize them. The renewal of health promotion is a strategic movement to revitalize the values, the relevance, and the impact of health promotion in an ever-changing world. And for the Caribbean, it represents a recommitment to the principles of the Caribbean Charter of 1993, where they had focused on empowerment, equity, participation, as well as intersectoral collaborations. And while we are doing all of that, we have to look at the modernization of today's realities, where we are looking at digital health, social justice, and the whole business of the sustainable development goals. So we need to identify the strengths, such as the improvements in communication and the support that we get from our partners, such as PAHO. And we still have PAHO and WHO on board, really partnering with us. We also have UNESCO and UNICEF. They are still a part of the international partnership that we do have access to. And there are currently 4 strategies to renew health promotion, and would have gone through those already. They re-energize the healthy settings, community participation and empowerment, better governance, and the strengthening of the healthcare system. And so in closing, this is your nugget for today, that faith doesn't always take you out of the problem, but faith takes you through the problem. Faith doesn't always take away the pain, but faith gives you the ability to handle that pain. And faith doesn't always take you out of the storm. What faith will do, it will keep you calm in the midst of the storm. And those are my few words for this afternoon.
Amen.
All right. And amen. And you would have already gotten the information, I think, in terms of the relook to the qualitative research.
Yes, the good news.
Yes. We aim to please, you know. We are really very careful about your mental health.
Yes. I appreciate it. Greatly.
So having said all of that,
But the checklist is still tomorrow.
if what?
The checklist is still tomorrow.
It would be good if you can do that because it would give us a chance now to go through that checklist. And there needs to be any correction for modification, and you can get that prior to going out on the road. So it really would be good if you could submit those.
Okay.
All right. So have a great rest of the day, everybody.
You too, miss. Thank you.
Thank you. Take care.